Let me introduce myself to you. This is who I am. No more, no less.
Sponsored by
doing something that maybe couldn't normally be done or nobody has taken an interest at. I like giving back to the ones that nobody wants. Today we have a very special show with two very important people in our community, and a third, which is no stranger to the show, Mr. Tomas Leon, CEO of People of Color Network. Welcome back, Tomas.
Thank you. Happy New Year.
Happy New Year to you, too. Before I let you introduce your guest today, because really this is his show, he's been on here more than me, I'm going to give the people that somebody from Wisconsin that's come down to the show that doesn't know who Magellan Services of Arizona is, or even People of Color Network. Give us a little background.
Well, I'll let my guest talk about Magellan Health of Arizona, and but I'm real happy to be here. I know everyone's focused on their New Year's resolutions and their health and wellness, and at People of Color Network, that's our focus all year round. I know with Magellan as well, but really our mission is to create and maintain healthy people of color communities. And so we're really focused on working with people and providing culturally responsive services to people who are experiencing behavioral health and mental health challenges. And so, you know, we're focused on turning that recovery and resiliency into living well. And that's what brings us here today. We have our funder, our partner, Magellan, who we have joined forces to really focus on helping communities get healthier and helping people, individuals, children, families, and adults who are experiencing severe mental illness to get on that recovery of health and wellness and on that path of health and wellness. And so we're here to really just highlight some of the work that we've been doing together and really focus on integrated healthcare and what that means for the people we have the privilege of serving.
And what a privilege, as I get into introduce my next two guests, it is to bring a element to the show that hasn't been on the show or hasn't been in this type of setting, to let you know who is doing this type of work in the community and the major responsibility and need that exists with that as well. With that, I am going to roll into my first guest, which is Dr. Richard Clarke. He is the Chief Executive Officer of Magellan Health Services of Arizona. Welcome, Dr. Clarke.
Thank you, Phil. I'm really glad to be here today.
So somebody that, like again, somebody's from Wisconsin, when they say funder Magellan, let's give an idea of what and who is Magellan Services for the person who doesn't know.
Magellan Health Services of Arizona is the regional behavioral health authority contracted by the Department of Behavioral Health, Arizona Department of Health Services, to administer and manage behavioral health services. That's mental health and drug and alcohol services for the county of Maricopa. Tomas is one of our contracted service provider agencies in both the children's and the adults arenas. They do some amazing work. We have over 150 providers in Maricopa County delivering healthcare services to around 81,000 individuals that are facing the challenges of a serious mental illness. And we find it to be an extreme privilege to be here, to focus our work on helping organizations like Tomas and People of Color Network really change the life of an individual every day, where they live, where they work, and where they play. And a lot of that has to do with how do we deal with the whole person. This is going to be an exciting year for us, and I think the behavioral health community, as we really think about how do we bring together the behavioral health needs that individuals have with their physical health needs and treat the person as a whole individual and help them in their overall well-being and character.
Awesome. And one of the things that's coming up on the show here in a couple weeks is one of those 150 provider aspects, which is going to be Impact La Frontera, suicide prevention. We're going to be, and along with integrated health, and trying to get that element out there as well. So what a blessing to have you on. The flow, so the viewer gets an idea. I understand it because I've done my research and I've been involved for quite a while. But for the person that says, okay, you've got all these organizations underneath you, you deliver massive amounts of services to people with mental illness and behavioral health issues, which is very needy in this society today. So it comes from the Arizona Department of Health, from the governmental side. Is that the correct verbiage? Then to you and you manage it? Is that about the way that it goes?
The Arizona Department of Health Services is the state entity responsible for delivering behavioral health services to individuals suffering from mental health and substance abuse challenges in the state. Okay. They receive money from the federal government and from our legislature, who was very concerned about these issues, and then that money is contracted to us to manage for the state as a private contractor.
What a responsibility you have. Wow. Okay, let's go into one of the things that, after reading a lot of information on you before we get into the clinical side of stuff with your guest as well as Tomas's guest, talking about integrated health, IHH, I guess, which is what you call it, integrated health systems, and talking about whole length of life, quality of life. What's integrated health?
Well, integrated health, and let me start first by talking about why this is important. Okay. There was a study done by Joseph Parks for the National Association of State Mental Health Program Directors in 2006 called The Morbidity and Mortality in People of Serious Mental Illness. And what they discovered is that individuals suffering from the challenges of a serious mental illness die 25 years earlier than those of the general population. So the question then becomes, why is that? And in Arizona, our data since 2007, working with People of Color Network, and has determined that in Arizona it's 27 years less. So you begin to take that apart and figure out what that is. And the first thing you find out is that individuals suffering from a serious mental illness are 12 to 13 times more likely to die from suicide. They have chronic comorbid medical conditions. In fact, 70% of individuals with serious mental illness have at least one chronic condition, like pulmonary diseases like asthma or chronic obstructive pulmonary disease or diabetes or heart disease or obesity or substance use or hypertension. 45% of individuals suffering the challenges of mental illness have 2 or more, and 30% have 3 or more of these conditions. So if you're suffering the challenges of a mental illness and you have this comorbid medical condition, integrated health is about bringing the practitioners together at the primary care setting and the behavioral health setting in organizations like People of Color Network, and bringing them together in a coordinated, integrated way to plan, to design, to develop, and implement care strategies that treat the whole person. In the past, what you've seen is individuals with mental illness are treated over here, their physical issues are treated over here, and now we're going to bring them together in a behavioral health-led mode. Individuals with serious mental illness have lots of challenges in reaching out into primary care settings and going to receive services and being misunderstood by the medical profession. And so we here, I think, have a really strong partnership with organizations like People of Color Network, Maricopa Integrated Health Systems, and those groups are coming together to design and develop an integrated service model through a thing we call the Whole Health Integrated Service Plan.
How well explained, you know, especially with the mental illness side of it, whether it's morbidity, if that's the phrase, as well as co-occurring. Yeah. Not just mental illness. It's all those other aspects that you folks have to deal with on a administrative level, on a clinical level, and so much seems to go into all that, where a lot of people, I believe the knowledge and that awareness, and should be the stigma that goes along with it, it's just mental illness, or somebody's just have a co-occurring disorder like addiction and substance abuse, or even bipolar disorders, and into that category, but so much more involved into that treatment of that person, of that whole person, like you had talked about as well. One thing that I really loved after reading some of the stuff that was sent over was about your health risk assessments and how many that you guys did. Yeah. Over 10,000 HRAs that you guys had did in Maricopa County. We got a couple minutes left before we go ahead and introduce Dr. Shareh Ghani. Shareh Ghani. I'm probably going to butcher that, but I'm going to let you introduce as we come back. We have a couple, about 60 seconds left. We'll be talking a little bit. One of the things I had as a question is HRA is a health risk assessment. Does that enhance the process when you guys do those assessments? Or did you find out more than you expected when you did those?
That tells us a lot about an individual from their perspective and also from their medical records. A health risk assessment gives us a look into an individual's life, from the kinds of physical health conditions that they're having to address, their social life, their behavioral activities and eating habits and things like that, where you can develop an entire picture of a person. The thing that's, I think, is really cool about these health risk assessments is the health literacy piece that comes out of it. And I was talking to an individual from People of Color Network a couple months ago who took one of these health risk assessments, and they were like, finally someone sees me as a whole person. They don't just see me as a bunch of symptoms of my mental illness. They now know that I've got all these other issues on the physical health side I have to deal with. I think it normalizes a person's life for them, because we all have issues that we need to come together.
We'll be right back. Take a look at a little thing we put together for Magellan. And before we go to commercial break, there's going to be some information on your screen right now from Magellan Health Services of Arizona. Go ahead, and if any of this stuff interests you and if you'd like to be a part of this, go ahead and take a look at that information. It'll be up on the screen, and we'll be back right after this break.
Let me introduce myself to you. This is who I am. No more, no less.
Before, addiction and depression kept me from living my life. Now, every step I take in recovery benefits everyone. For information and treatment referral for you or someone you love, call 1-800-662-HELP. Brought to you by the U.S. Department of Health and Human Services.
Impact from hail can result in extensive damage to your roof and ultimately your home or business. Protect your investment with one call to the residential and commercial roofing experts at Diversified Roofing. Serving the Valley for over 20 years, Diversified Roofing Specialists will perform a free hail inspection and handle the entire claims process from start to finish. Don't risk further damage from monsoon winds and rain. Call Diversified Roofing now to schedule your free inspection. Diversified Roofing, protecting families and businesses from Arizona weather for more than 20 years.